My name is Dr. Pablo Pazmino. I'm a board-certified orthopedic surgeon with the American Board of Orthopedic Surgery. The Clevair mask, it's the best quality mask. I insisted everyone in my office use it for patient interaction so that I know they're safe here in the office setting. The first time I wore it in the operating room, I placed it, it was instantly comfortable. There's an internal fan that during surgery makes breathing through these masks very comfortable. The standard mask that we use in surgery is a typical surgical mask. With the coronavirus, we felt safer using a KN95 mask. On first glance, people think, oh, that's a KN95 mask, but as they look closer, they see there's a blue light, there's a little mechanism on the outside, and they start wondering, I've never seen something like that before. Where can I get that? I noticed, instantly against my face, I wasn't having the discomfort of the fibers, which as a typical KN95 mask break down and become uncomfortable as they gather moisture and start, irritating my face. Here we have a mask where there's an internal fan and it's constantly cooling the inner aspect of the mask. So that's something we don't even have to worry about anymore from that standpoint. The other thing, since medical school, on a regular surgical mask, I've had to put a piece of tape to seal the mask against the remainder of my face to prevent it from fogging my glasses. During surgery, we wear glasses that are lead-lined to prevent us from getting cataracts or just blood splatter. So I've always had to wear a piece of surgical tape between the mask and my skin to prevent that fog from making those glasses unusable. This mask, it has inside like a silicone seal. It just naturally allows this comfort, but also prevents the fog from going into my glasses. During the case itself, it was more comfortable than I'd been before because you have this kind of internal fan mechanism which is constantly refreshing the air under the mask, which we've never had any mask that does that, quite frankly. The KN95 mask filters a certain percentage of air. This filters even more. On top of it, there's a UV light. We were just starting to use UV lights in the operating room to sanitize the room between surgeries. And now the fact that it's incorporated into the mask is a great idea. The other thing, we don't have to worry about these ear loops. I know most people, just walking around have masks that have ear loops, and those, they really start irritating and really start, bothering me after, I'm doing a long surgery or even just wearing them throughout the clinic. These have two straps, one that goes higher up on the skull, one that goes lower down. And those are more comfortable from the standpoint of masks. That's how we've been using masks forever in surgery. Now we're seeing these masks as a result of coronavirus that have these ear loops. Those are never the type of masks that surgeons wore. If you gave surgeons a lineup of masks, this one has ear loops, these three don't, no one's ever gonna pick the one with the ear loops because we've always disliked those. So the fact that this eliminates one of the more uncomfortable features of a KN95 mask is huge. Since getting the Clevair mask, I've been using it nonstop. I use it even hanging out in the surgeon's lounge because you never know from the standpoint of who's around you what their exposure has been. And as a result of the comfort level provided with this mask, it's not something that as soon as I'm out of the operating room, I just want to rip it off. It's something that I can leave on and I can wear comfortably throughout the day. If everyone had one of these masks, they'd find an increase in the general population of wearing the mask because the mask is actually more comfortable than any other mask. And as a result, we'd see the numbers of infection rates drop. Outside of the OR, it's something that has made it more comfortable for us in a world where we didn't used to wear masks all the time. Well, now we're in that world where we have to. So it's nice to have something that not only keeps us safe, because it has more filtration available than any other commercially available mask that I'm aware of, but it also is comfortable to wear. It's so important to provide these to people on the front lines who are seeing patients. This virus, we don't know who has it. It could be a patient that just walks in, and if you have this in the hand of every medical provider, especially those on the front line, this is the mask that's going to keep a lot of people safe moving forward.
Welcome to Clevair. You may now breathe freely.